Hello, this week we're going to be talking about epidemiology. I'm going to be giving a brief overview of Chapter 4 and also hitting on Chapter 9. And then I'm also going to highlight the things that you need to get done this week. Here we go, let's get started. So first we're going to start with epidemiology. This is the basic science of public health. And if you break down epidemiology, it means the tracking of diseases, the study of diseases. So one of the big things an epidemiologist does is they verify the diagnosis. They first make sure it's really the disease, because a lot of times people will say, I've got food poisoning, but really they don't have food poisoning, they have the stomach flu. So first thing they do is they define it. They create a case definition, and then they start to do surveillance. They start to ask when, where, who, what, where the person was, and who they've been exposed to. So really covering who's getting the disease, when did they get the disease, where is the disease occurring. So for example, let's say we have a measles outbreak and someone's in our class and they have symptoms of the measles. This is a very, very contagious disease. So within 2 hours, even after that person left the classroom, anyone who's been in contact with that person would have to track down. So it's tracking down people who have diseases. First, they look at, one of the big things they do is also do foodborne outbreaks. So they look at where the outbreak is, defining and finding the cases, creating a hypothesis through interviews, and tracking down people. Even all the way to the point till after everyone's gotten better, to make sure that the disease outbreak is contained. So one of the things an epidemiologist needs is they need to be very good at statistics. They're very much into research and analysis. They have high thinking skills. They should be knowledgeable of medical and biological concepts, so they should have a really good, solid background in medical concepts. And then, of course, they need to understand public health and how the public health model works, who to call, when to call, things like that. The father of epidemiology is Jon Snow. Now, this is not the Jon Snow that we know on Games of Thrones, but this is the Jon Snow that was a doctor in London who tracked down the spread of cholera by looking at and testing where people were getting their water. He determined it was spreading through water. And what I did was I put a really cool little video that shows Jon Snow and how he tracked down cholera in your Canvas module. It won't take that long to watch, and it takes about 10 to 15 minutes max, and it gives you the story of Jon Snow. So here's the thing, is that Jon Snow was the first example of how he used epidemiology. He found an epidemic. An epidemic is an outbreak of a disease in the mid-1950s. What he did was he thought it was in the water supply, which came from the Thames River. And the Thames River was very, very dirty. It was not hygienic. And we know that cholera spreads under under conditions where it's unsanitary. And that's one of the things that started to get us to really think about making sure our water supply was clean. So I posted a YouTube link right here. I also posted the video in Canvas. Watch that video, and you'll see how Jon Snow became the shoe leather detective of disease. So here's the other page here of the cholera outbreak and pictures from it. And you can see that I like this website. If you click on it, you can get the whole idea of why hygiene and environmental health became really important, because as you clean up your water supply, you start to control disease. And Jon Snow was able to find the disease and start tracking it down. So I want to talk about other diseases that we started to track down, Legionnaire's disease, and other diseases. And I would like you to specifically look up these 3 diseases in your textbook and see how they started and how we were able to track them down. One of my favorites is the Legionnaire's disease. And without giving a spoiler alert, it was found at a conference, at the Legionnaire's conference, and it got the name from being discovered at this conference. And I'm also going to challenge you to figure out how it started. Now, we were in class right now, face-to-face. I'd break you into groups and ask you to be like an epidemiologist and look at these diseases and see how it started. One of these diseases started with a water coolant, the air conditioning, the water being tainted. Another had something to do with tainted and bad oil. Well, you can kind of see that the toxic oil syndrome's there. But you could see how these diseases started with something that went tainted, and they had to track it down to control it. So right now, take out your book and look up these diseases. Tag them in your book, because I'll be coming back later asking you about these 3 diseases, or specifically to describe one of them. So one of the big things out of tracking diseases is that they require that doctors always report diseases to the health department. And they've created a list of diseases called Notifiable Diseases. These are diseases that doctors are mandated to tell the health department, and then the health department's mandated to tell the state, and then the state's mandated to tell CDC, Center for Disease Control. These are the list of diseases. So what I'd like you to do, I challenge you to do, is to click out onto the Kern County Public Health Department and look at the infectious diseases that are considered priority diseases for our area. You should know these as a public health person. What are the diseases that we are specifically tracking and asking doctors to notify? And these are considered diseases that are notifiable. Some of these diseases are endemic. Endemic means specific to Kern County. So, for example, valley fever is endemic to Kern County. And you're going to hear me use that term a lot in the future. And some of these diseases, we have a high prevalence rate. That means it's always prevalent in our community. And some, we have high incidence rates. It means it just happened. We have new cases. So take a look at these diseases and start to see which ones we've had recently and which ones that are being tracked by our community. So when you think about epidemiology and you've now are going to be tracking down these diseases that I've asked you to look up in your book, the Legionnaire's disease, the others that I asked you to look at, and you've read your chapter, and as you read the chapter, think about why is epidemiological surveillance important to public health? Why do you think an epidemiologist is so important to public health? We're going to have an epidemiologist coming into our face-to-face class this upcoming week, and I'm going to be recording it and posting it in week 3 for you guys, the hybrid class. So you're going to have see an interview with an epidemiologist. But why do you think an epidemiologist is really important? What role would it play if there were a bioterrorist attack? So I put in some video links to diseases like smallpox, which are not around. It's been eradicated. But let's say someone decided to take smallpox, anthrax, one of these diseases, and decide to infect people with a highly contagious and deadly disease. What would it play in a bioterrorist attack? How would an epidemiologist play into that? Think about that. Okay? And I can tell you that an epidemiologist, if you're thinking what I'm thinking, as an epidemiologist would be key in identifying where the disease started and containing it. So if you start thinking along those lines, you're right. An epidemiologist is a shoe leather detective. So epidemiologists also play a big role in chronic diseases. They've been tracking asthma, lung cancer, heart disease. And so an epidemiologist also looks to see how the trends, if the diseases of lung cancer are going down or going back up. So let's take a look at this, this chart here with lung cancer. And we can see that over time, that we've seen that cancer death rates, and this is, first of all, this orange line is the annual cigarette consumption per capita. So you can see how it was really high in 1962. And then we see lung cancer death rates. And look at that, they start to increase as the cigarette consumption increases. And they start to decrease as our cigarette consumption decreases. An epidemiologist would point to those trends and say, lung cancer, and this is where statistics comes in, there is a positive correlation with lung cancer and cigarettes. As someone consumes and smokes cigarettes, their chances of lung cancer go up. As someone decreases their consumption of cigarettes, lung cancer goes down. So this gives you an idea of an epidemiologist at work tracking these diseases. So looking at that chart there, what do you think an epidemiologist has contributed to people's understanding of heart disease and lung cancer? And I can tell you with lung cancer, you saw it with how cigarettes are correlated to lung cancer. So that could start to get people to understand it. With heart disease, you might see that we can track maybe consumption of fatty foods or having high blood pressure and charting those habits, and then watching to see someone's chances actually increasing and having more heart attacks as they do certain behaviors. So an epidemiologist charts things and looks to see the data trends. So I'm going to ask you this question. Right now, CDC, you're going to click out on this. It's called the Morbidity and Mortality Weekly Report. I want you to click out on this, and I want you to discover and this is going to be one of your discussion questions for this week. What is one of the cases that CDC is currently investigating? And so I want you to take a look at this. The Morbidity and Mortality Weekly Report is put out every week by the Center for Disease Control to the whole entire public health community and to doctors so they can trend to see what diseases are out in outbreak, what diseases they need to keep an eye open for. So this report right here, MMWR, is where the first case of AIDS was reported. So then it was picked up by the New York Times and by newspapers, and then the word got out. So MMWR is where we report and where diseases are where they're given in a report and put out to the whole entire United States so we can start to see what the trends are. So take a look at that website. So I'm going to ask you then, in my discussion question that you're going to see in Canvas, what are the pressing concerns and what are the issues? What information would you want to know more about? So take a look at that CDC chart. And then I'm going to be posting epidemiological terms that I'm going to be posting in Canvas. And I would challenge you to look at those terms and make sure you're familiar with them. I'm going to be highlighting them again next week, but go ahead and take a look at those epidemiological terms. So that is a real brief overview of Chapter 4. And what I'm going to ask you to do is to pause the video or come back to the video and then come back and look at, listen to Chapter 9. But what you should be going through right now is taking a look and clicking on all the videos and links under Chapter 4 to get your head wrapped around it. Now, I'm going to go ahead, I'm going to minimize this, and minimize this. And we're going to pull up, I'm going to pull up chapter 9, and we're going to be talking about infectious disease. So with that in mind, you know that an epidemiologist is constantly tracking diseases. So what diseases do they need to constantly be tracking would be one of the questions I would want to know. So one of the things that they need to do is they always need to track a disease from incubation period all the way to the very end of the whole stages of infections. So you have to understand that there's a phase where people have no symptoms and they're very much capable of spreading the disease, and then it starts to go away, but they're still contagious. So this is what really important for an epidemiologist and for public health professionals to be aware of. Now, pathogens, these are infectious agents capable of causing disease. They often live in large communities called reservoirs. So this is where diseases live. And so if you look at pathogens, you can think path means disease and gen means agent. So they're disease agents. So some cannot survive in these reservoirs, in these areas, and they have to jump into a host. And a host is a living organism where that pathogen can survive. So they come in and they infect, and then they have a portal of exit and a portal of entry into a new host. They keep spreading. That is a pathogen. So the chain of infection goes by where it goes from an infectious agent, a pathogen, and then it passes from one organism to another. So pathogen, reservoir, place of exit, method of transmission, and it keeps on going. So if you think about a pathogen, let's think of maybe malaria, which is a disease that mosquitoes carry. The mosquitoes carry the disease. They jump on a person. They infect the person. Then they bite the person, and then they're infected by the bite, and then it goes into the blood, and then it goes through the person, and then they have malaria, and then it continues to be passed on, and it moves through that chain of infection. Measles, same idea. It's a viral. It goes into a person. It passes through a reservoir. It's highly contagious. It can be passed through air droplets, aerosol in the air, and it keeps on passing through. So one of the things that you'll hear about is a vector. And I mentioned a mosquito before, but a vector is an animal or insect that transmits a pathogen from a reservoir into an infected host to a new host. So vectors are an animal or an insect. So let's think of some vectors. Dogs, cats, humans, rats, rodents. It's something, an animal or an insect that passes the disease on. And then virulence is how fast a pathogen can move. So if I tell you a disease has high virulence, it means it's highly infectious. So measles is very virulent. It has high virulence. It is highly contagious. And the chances of infection are very high. So it can spread and stay, be passed within 2 hours, even after someone has been in a room. And an epidemic is a widespread outbreak of a disease that affects many people. So epidemic, epidemiologist, you can see that epidemiologists study epidemics. So I want you to be familiar with the different types of pathogens. And what I do in my face-to-face classes, I actually have a game where I split up the viruses, the bacteria, the fungi, the different types, and then I give people diseases, and then I see if they can match the disease with the pathogen. So if I said tuberculosis, would you know what pathogen it would be? If I said hepatitis A, what pathogen would it be? So to answer the question, tuberculosis would have been bacteria. Ready? Here comes another one. Hepatitis A virus. Okay. How about candidinitis, yeast infection? It's a fungi. How about ticks, ectoparasites? And ticks, by the way, are big time spreader of diseases. You've heard of different diseases out there like Lyme disease. So take a look at that and see if you can match those up. Be familiar with these. You're going to see these again. So one of the things that happens is that Koch Potzlitz, he was a famous German physician who established that bacteriology as a science. He identified a bacteria that caused anthrax, cholera, and tuberculosis. So it's the idea that if you identify a bacteria, can you prove that it actually causes a disease? So we know that bacteria, that we can identify the bacteria that causes tuberculosis, the bacteria that causes cholera, typhoid, tetanitis, diphtheria. We know the viruses that can cause smallpox, polio, hepatitis, measles, rabies, AIDS, yellow fever. And we know that there are certain parasites that can carry malaria. Okay, so you can see the list here. And so we know that these are infectious agents that can spread diseases. So one of the big things is that you need to know the means of transmission. People can either pass a disease person to person, aerosol that's in the air, touching, contaminated object, putting hands to mouth, nose, or eyes, contaminated water or food. And one of the big one is fecal oral. So from someone doesn't wash their hands, they have a little feces still left on their hands. They touch their mouth, and now they've got fecal to oral route. And then this then could be passed on to food. Vectors. Vectors, again, are animals or organisms that can pass the disease. So, for example, animals that, like dogs, can pass rabies, okay? Rodents can pass the bubonic plague. Sexual contact, sexually transmitted diseases. So these are some of the big ones. And then, of course, carriers. There are sometimes people who show no symptoms, but they are infected, and then they can carry the diseases around. So these are the means of transmission of diseases. And this is one of the things that public health officials are always kind of going out and trying to figure out how a disease is transmitted and then breaking that transmission. So here are some big ones here that were conquered by the 1960s. So immunizations were big. Think about this. Immunizations, because of immunizations, we have eradicated polio in the United States. And if you click on this link, you can see the diseases that have been eradicated, completely taken off the face of our map of diseases because of vaccines. Now, the problem with vaccines is if people don't get vaccinated, then the disease can come back because vaccines work off something called herd immunity. And I have a video in there that shows herd immunity. That's how you contain a disease, is that you get everyone's resistance up. Of course, we know about antibiotics, and antibiotics have been huge in controlling diseases, but unfortunately, we've overused antibiotics and we're starting to get antibiotic resistance now. And we have public health measures like the purification of water, proper disposal of sewage, pasteurizing milk has been huge. And then, of course, improving nutrition and personal hygiene. So it's all about interrupting the chain of infection. So these are the things that people do. We kill the pathogen with antibiotics. We eliminate the reservoir. So like I remember once, remember how we used to have an outbreak of we've had an outbreak of West Nile virus, and we had a lot of houses that were abandoned when we had that housing crisis. And so the public health department started to give out notices to people who had abandoned pools where mosquitoes were breeding. So, eliminating standing water is a big way to get rid of that cycle. Preventing transmission, washing hands, quarantine, where you isolate people and they can't interact with each other. And then condoms have been used in creating a barrier of stopping the spread of infectious disease. So, and then, of course, increasing the resistance of the host by immunizations. Vaccines have been very important in building and controlling the resistance of diseases. So, there are public health measures. And these are the big things that we do. We do epidemiological surveillance. We do contact tracing, where we actually track down people. We do immunizations and treatment to make sure it doesn't spread. We quarantine if necessary, so we isolate people. So I'm going to ask you to watch the CDC videos in this module and see how they're controlling the diseases. And I love the one about the Ebola virus and how they controlled that disease, how they were able to get it contained and controlled. Now, it's still out there, but it's about containment. So take a look at this video. CDC Role on Diseases. Click on it, and it'll bring you to the video about the Ebola virus and how they controlled it. So another thing is that here's another example of public health measures: rabies, the surveillance of wildlife, the immunization of dogs, and then also giving prophylactics after the exposure. Now, here's the big thing. If someone does not come in and get this immediately after exposure to rabies, once rabies sets in and the symptoms start, it cannot be stopped. So this is one of the big things, is tracking this disease. So take a look at this, capturing bats, like never touch a bat. Bats can have rabies. If you find one, don't touch it. Okay? So take a look at this. One of the things that I ask you to do is I'm going to ask you to go out to, I would ask you to go out to the rabies website and look at I'll put the rabies link in there so you can see how the diseases are controlled. We've really controlled rabies. I mean, how often do you hear about rabies cases now? They're very, very uncommon. So these are some of the big diseases in the past, bubonic plague, tuberculosis, smallpox, cholera, typhoid, typhus, yellow fever, diphtheria, measles, influenza. And I love looking at this disease chart because you can see how the diseases hit New York City. Take a look at this. You can see yellow fever, cholera, smallpox. Look at the influenza outbreak in 1918. And then you could see HIV hitting. And then the World Trade Center, that's considered a terrorist attack, and that's a public health disaster. So when public health happens and bioterrorism happens, that's considered a public health crisis. So look at the trends of diseases in New York over time, and you can see how these diseases and how they impacted people. And you can also see how things started to come in with the control of typhoid carriers, the chlorination of water in 1910, milk stations for babies in 1911, and then pasteurization of milk in 1912. So you could start to see how we start to put public health measures in and we start to control diseases. So one of the big things is eradication in public health. It's getting the disease completely off the map. In 1977, smallpox was eradicated. It's not there. Now we have like the disease in a the virus, the pathogen in a controlled laboratory. It's considered a bioterrorism threat, but there are no smallpox left. Polio has been eradicated from the Western Hemisphere, and the discussion question I'm going to ask you is, I'm going to ask you where it still exists. And I'm going to tell you in your book, it's going to tell you where it exists, but I'm also going to tell you in this lecture. In the Middle East, Pakistan, Afghanistan, But go out to the website that I put out there and look and see where it exactly is right now. I'm going to be asking you that in the discussion question. And then measles is the next target. It's no longer endemic in the US. Endemic means that it's not a local disease, but the reality is we still have outbreaks of it. And we stress that. It's still a problem. Why is measles still a problem in the United States? Because people do not want to get vaccinated sometimes, and we lose the herd immunity. So I want to stress that. Measles can be contained, but it can't be contained if people do not get the vaccine. So we've got kind of a quandary here and paradox. So if people do not get vaccinated by measles, for measles, then they need to stay away from people who are vulnerable of getting measles. So that means that there's an obligation for people to stay away if they are not. So one of the things I'm going to ask you to do, the Jigsaw Approach, is I want you to see if you right now can identify a pathogen, what its route of transmission is, and how it can be interrupted. So let me see if your brain can do this right now. I'll give you an example. Let's think of one, tuberculosis. Is that a bacteria, virus, or parasite? If you said bacteria, good. What's the route of transmission? Okay, aerosol. It's very highly infectious. Can it be treated? Can it be interrupted? Yes. How can it be interrupted? Antibiotics. What's another one? Quarantine. Screening. Is it eradicated? Does tuberculosis still exist? The answer is yes, it still exists. So try to see if you can do this with one disease all the way through. This is what a public health approach looks like. It's identifying the disease and then figuring out how to eradicate it and how to control it. So smallpox, is it eradicated? Yes, it is eradicated. And here's the history of it. I put a vaccine history. This is such a good little video by TED Talk. Click on it and watch it. And you can learn about how smallpox was eradicated. Bubonic plague, eradicated? No, it's not eradicated, but it's controlled for. How is it controlled for? It is, I'm going back because I want to cover it. Bubonic plague, is it bacterial? Yes. How's it treated? Antibiotic. How's it spread? Rodents. So that kind of gives you an idea of how these big diseases that were big in the past, we've learned how to control them. Typhoid. Controlled? Yes. Containable? Yes. And I would love for you to read up on the history of Typhoid Mary. Typhoid Mary was a cook, and this is in your book. She was a cook, and she spread the disease, but she was a carrier of the disease, but she never got sick from the disease. And they quarantined her for the rest of her life. Yes, you heard me right. Now, she was very angry about that. But think about that. If someone's a carrier of disease and they didn't know how to control it, what's the only option that they have? Quarantine. So it was a big debate, and read about that in your book. Measles. Measles is controllable. It's a virus. We use vaccines, but and I put the Disney guy up there, Mickey Mouse, because we had a huge outbreak of measles in Disneyland. Highly contagious. And so take a look at that. CDC has a whole entire page on measles and its diseases. Diphtheria. Controllable? Yes, with a vaccine. Contagious? Yes. Okay. So there's fear of vaccines, and there's rumors of vaccines causing autism and SIDS. But one of the things that people need to understand is that causation does not equal correlation. So causation means, I meant to say correlation does not equal causation. I got that backward. That you can't just have experiences and then and then tie them together. So things need to be, actually go both ways with that. Causation does not equal correlation. Correlation does not equal causation. It means that basically if someone has a side effect or some effect of it, it doesn't mean that everyone's impacted that way. Yes, there are side effects to vaccines. And yes, some people are very vulnerable, but that does not mean it impacts everyone like that. So one of the things is that accepting the risk and really educating people on what the risk is really important to reduce their fears. The only problem is that if people start to refuse vaccines at a big level, we'll lose our herd immunity. And these diseases that have killed and then have high virulence and then have a high death rate will come back, and we will not be able to control them. So vaccines are a way for us to control diseases. So one of the things that pharmaceutical companies sometimes have been reluctant to do is develop vaccine for low profits, and they've been worried about risk of lawsuits. But the reality is that sometimes in order to control diseases, you have to have minimal risk, and that's one of the things that public health officials often weigh. What are the risks compared to the benefits of controlling a disease? I talk about herd immunity a lot. You've been hearing this. Herd immunity is if some get vaccinated, the virus spreads. If most get vaccinated, the spread is contained. So look, the red person in the middle has the disease. The blue person could be infected, and they could easily get it. So do you see how the red person changes all the blue to red? It's because it's spreading from red to blue. The yellow people have been vaccinated. And what that does is it creates this barrier between the people who are vaccinated from the people who are vulnerable. So when people are vaccinated, we start to control the disease. So I'd love for you to look at the rates for vaccinations. How many vaccinations, and what is the percentage of vaccinations in our area? If you drill on this right now, if you double click, you could actually put in a school in this database, and you could see what the percentage of vaccination and what the rate is for that school. So you can actually get an idea of how many children are actually vaccinated at school that your child or grandchild or goddaughter or whoever is going to, and you could see what the level of herd immunity is for the school in your area. So double click on that, and I want to tell you, with these PowerPoints, you can double click on the PowerPoints when you put them in presentation mode and see and go out to the hyperlinks. So after watching this video, if you want, I'd put these PowerPoints into slide presentation and double click on them to go out to the videos. So take a look at this. Visit the CDC website on vaccines and immunizations. What evidence can you find about the safety of childhood vaccines? So what do you think the benefits outweigh the risk of vaccinations? So if you are ever talking to someone about why they need to have their child vaccinated, this is really important because you need to give them this information. It's very important to address people's fears with information. I think the worst thing you could tell people is, don't worry about it. They're already worried about it. The best thing you could do is give them information so they can weigh the risk and feel comfortable with the medical decisions that they're making. So what about rabies? Where is U.S. Rabies endemic in animals? So where do you see rabies happening the most? Have there been any cases of rabies in the last year or so? Here's the website I was talking about. Go ahead and click on these two links, and it will actually take you out to the rabies websites. And you can see how endemic and whether we have an epidemic of rabies in our area. And so, that's the same question twice, so don't worry about it. Just go ahead and drill into this. How about measles? Is there an outbreak for measles? I talked about it earlier. Yes, we have had outbreaks of measles. And lastly, this is the discussion question that I've posted for this week. Where is polio currently? And if you click on this, on the graphic here, it will take you out to the website and it will show you exactly where polio outbreaks are happening. So go ahead and take a look at that. Okay, great. So now That power, you can watch this video a couple of times, move it around, have me repeat things. But now I'm going to go to what you need to get done this week. Okay, I'm going to go ahead and show that to you. And we're going to go out here, and we're going to move to, yeah, good. Move to this week. So right here, I'm going to be posting the video right there. These are the 2 PowerPoints for you to download and for you to, and put them in presentation mode, and then you can hyperlink back out to the items. Here's a cool Jon Snow video. Watch it. It's really good. Jon Snow was a father of epidemiology. Here's a website for all the reportable diseases for Kern County. Good for you to know. Here's a video for the CDC response I have embedded in the PowerPoint. Here's an example of that morbidity and mortality weekly report that's embedded into the PowerPoint. And then so I posted some links here on how bacteria spreads, herd immunity, and the story of smallpox. And these are all embedded into the PowerPoints, but if you for some reason have problems getting to them, I also put them here. Now, what do you need to get done this week? After you've gone through the PowerPoints and you've read your chapter, and you've gone through both of the PowerPoints and you've listened to this lecture and you clicked on all the links here, you've got 3 items that you need to get done this week. First, you need to do a discussion on CDC and MMWR. That's some morbidity, mortality weekly report. Morbidity is illness, mortality is death, and that's the CDC report. Then you're going to answer a question on tracking diseases. It's going to be an actual assignment where you upload. And then this is not due until February 5th, but this is your chapter review, and you're going to attempt the chapter review. These 2 items are due Monday of the following week. This item is not due until the first quiz. Okay? So you see these are your 3 items that you need to get done. These 2 are due within a week. This is due February 5th, but I would knock out all 3 items. Okay. If you have any questions whatsoever, Canvas message me through the inbox, post a frequently asked question, or contact me. So go through everything in week 2, listen to this lecture, and then go through everything in week 2. All right. Have a great week.